Good morning, everyone. Welcome to a first live that we haven't had since last year. We are here today with the founder and executive director of ICP Care, Donna, who is going to share about ICP Awareness Month, her story, and how we can find out more about her organization, ICP Care. So, Donna, thank you so much for joining us today. We haven't had an Instagram Live in a while, so I feel like I'm a little bit rusty, but I'm so excited to, one, see you because it's been a while since I've seen you, and to have you on during this Awareness Month to spread and share information about what ICP is. So, welcome.
Thank you so much. I'm so happy to be here to have just, again, spreading awareness of cholestasis of pregnancy with your audience, your community. It's so very important. We're both in this together as organizations in regards to really preventing stillbirth, which is the most distressing, horrible, heart-wrenching, risk to cholestasis of pregnancy.
Yeah, so let's start in the beginning of how you got here and what brought you to this work. I know that for me, this was not a condition that I had heard about until I entered the stillbirth prevention space. And I feel like, unfortunately, many pregnant people don't find out about this until it's happening to them. So let's go back and share whatever you are comfortable with in your journey for how you got here.
Sure. So just to start, I am Donna Benavides, as you introduced me, as the founder of ICP Care. And my story began 22 years ago when I was pregnant with my son, Jordan. I was healthy as can be, and I had a beautiful pregnancy, I can say. There was nothing that I was having, any symptoms. And when I turned 33 weeks pregnant is when the itching began. There was itching in pregnancy, and you read in the books, it's fairly normal. And I talked to my family, my friends, and nobody thought anything of it. But it was just a really unusual itch because it was more intense at night. It was more intense at night. So it began in my hands, the palms of my hands and the soles of my feet. And it was unusual. But then at night, it was a little bit more prevalent. So then I brought it up to my doctor when I was, my next appointment, it was at 34 weeks.
Okay.
And I was being seen by a group of doctors. So the doctor was like, "Oh, just use hydrocortisone cream, just to see if that'll help." Because, again, pregnancy itch is normal.
Yeah.
And then I tried it, and to no avail. It did not help at all. And then on my next appointment, which is the following week, at 35 weeks, I saw another doctor, my other doctor, and she said, okay, well, she kind of had a little red flag because she knew she had a patient prior that had intrahepatic cholestasis of pregnancy. So she said, okay, well, let's do a blood test for you. But, doctors don't want to scare you. And especially this was, again, 22 years ago. Management was not really there for this. This is a rare pregnancy condition. It's more common and prevalent. With awareness, it's getting spread more.
Yeah.
But so back to my story, she gave me blood work and again, she didn't really talk to me about the risks and everything then. She just was like concerned that it could be that. And then sure enough, the next week when I got back, 36 weeks is when I was diagnosed. So throughout this process, again, the weeks that went by, my condition just got worse. I was just itching at night. It was just bad. The clothes that I was wearing, I would have to take it off because I thought the tags, were just affecting me more. But it was just hypersensitivity to the skin. And so I was diagnosed. There was a plan in place regarding induction at 38 weeks, which, again, that was something that was planned and agreed upon. The thing is that my symptoms were bad, but my bile acid levels, which is what's diagnosed, was really, really, really high. And again, this was 22 years ago. Things were very different. The Society for Maternal SMFM, there were no guidelines. There was really nothing there. I wasn't given the medicine that was used back then, that's currently still used, Ursodiol, that may have helped. Again, my doctor had maybe 1 or 2 patients. And again, the way I presented during my doctor visits, where I wasn't like really itching and like really, and I think honestly, I think that, and I tell this to a lot of people when I tell my story, that I have like a higher either pain tolerance or itch tolerance, and again, it varies from person to person, but at night it was really more prevalent. So there was a plan in action as far as, being induced at 38 weeks. I was having non-stress tests. And again, non-stress tests are just as good as for the time you're on the monitor. And, he was always fine, thankfully. And then at 37 weeks and 4 days, I had my last non-stress test. And I went back and I was, just going on my life, knowing that I was going to be induced within a couple of days, going to work. And I went to work one morning, and I was taken aback because I was just like, okay, I really don't feel him moving. And the night prior, he was kind of kicking a little bit more, and his movements were a little bit more. They were different. They were changed. And back then, I wasn't educated on counting the kicks and how important it is to monitor your baby's movements. And if there's indeed any changes, whether it be less movement or more movement, that's a red flag. And and all the education that's out nowadays is just beautiful. It's amazing with count the kicks, with just knowing, to really follow your baby's movements and just to take action if your baby indeed is moving less or more, or just any change in your baby. Yes, exactly. So I went to work, and I was concerned because I was like, oh my gosh, I don't feel him moving, but I'm a very optimistic person, very positive. And I said, okay, well, I'm sure everything's fine. I'm just going to call the doctors. So I call the doctors. Yeah. So I call the doctor, and they're like, doctor's office, like, okay, well, just come in. So I went in, and then the nurses, they had the little Doppler moving, and they couldn't find a heartbeat. And so, they brought the doctor in. The doctor did the Doppler, and to no avail, no heartbeat. And so she took me in to get an ultrasound. So it was right across the room. And then, so I had an ultrasound done, and it was just her and I. And she said to me, words that you never, ever want to hear. Nobody ever wants to hear these. No mother, no parent wants to hear that, your baby has no heartbeat. Yeah. And I'm sorry. So and it was just devastating. From that point on, I always say that I was shocked. I was in a state of shock. I cried. I let out a horrible, scream of heart-wrenching, loss and devastation. And, but it was just really difficult, and he had passed away, and it was just something that I had never thought that I was going to lose him from this condition, even though I did read it was a risk, but it was a very small percentage. Yeah. And again, everything was quite different 22 years ago. But then I did end up having 6 months later, I did get pregnant again with my son, Brandon. And I was seen by high-risk pregnancy doctors. Everything was very, very different. I was diagnosed earlier. I was put on the Ursodiol medicine. And so again, with knowledge comes power, and with experience comes, again, just a better and a positive outcome. Yeah. So he was born at 35 weeks and 5 days, actually. And then a year after, when he was turned a year old, I found out I was pregnant again. It wasn't planned. He was my beautiful surprise, my beautiful gift, Evan. And so he was, again, I had cholestasis of pregnancy with him, but the symptoms presented a little bit different because they were quite later. And I thought, oh, well, it's going to pass me by. I'm not going to have it. But that wasn't the case. What ended up happening is I did have a symptom, which is at 30 and 31 weeks, I went into preterm labor. And that's one of the risks of early delivery. Yeah. You want to be born early, but you want to cook and be there, yes, of course, longer than not. So that's my story in regards to my experience with intrahepatic cholestasis of pregnancy, and then from my story and from my experiences where ICP Care was born, and we are a 501c nonprofit organization. We're here to really provide evidence-based education, support, and resources to really have everybody be aware, but also just to advocate, be your best advocate for yourself and your baby. And because this is somewhat rare, and then again, there's a lot of information, a lot of unknowns in regards to when you're pregnant. You're like, okay, and then there's so many factors about this that you really have to understand and know.
Yeah.
And one of the big things is that I love to really mention is, if you're indeed itching in pregnancy, it could be just normal, but it could very well be this, and you just ask for a blood test. And then exactly. And if it comes back normal, your blood test is normal, that's fine. But if you continue with symptoms in regards to itching, that's a red flag. Just get another blood test, request another blood test, because we do find that it could take about 1 to 2 to 3, maybe 4 blood tests and before it shows up as diagnosed in the blood test for the bile acids. It does happen. Have seen it in our community. It is out there in literature as well. So, that's just really important to communicate.
Yeah. Wow. So I have so many questions. So when you got this devastating news in the hospital, was it pretty much understood that this is what had caused the stillbirth, or was it still questionable as to, was this the cause?
No, it was definitely known that it was the cause, because I was diagnosed, thankfully. And, there are cases within our community that if they weren't diagnosed, but they clearly had all the symptoms, specifically the itching, they weren't diagnosed. But then when they have their second baby, they have it again. So it's kind of just like, okay.
All right. And then that brought me to my next question was, is this something that you will have in every pregnancy if you're diagnosed once? Is it guaranteed, or does it maybe not happen in each pregnancy?
Well, it is 60 to 90% recurrence rate in your next pregnancy. And in my case, I had it in all my pregnancies. Yeah. So there is a chance that it may skip the pregnancy. Yeah. But it's not guaranteed.
Yeah. I mean, those are pretty high percentages. And I love how you mentioned advocating for yourself, and it pushed, we always say know your normal in regards to fetal movement. And we really want to educate parents to ask questions. And you also mentioned how providers might not want to scare parents or make them nervous. We want our babies here. And if that means that we need to find out some information that might, stop us a little bit, we still want that education to keep ourselves and our babies safe. And so you mentioned the itchiness. Are there any other major symptoms that may happen? I'm just envisioning someone having the symptoms, maybe of itchiness, maybe of something else, telling their doctor, and kind of the doctor just brushing it off. Like, what is some advice, or what are some buzzwords or things that people can say to kind of clue that doctor in? Oh no, I know that you need to be taking this a little bit more seriously.
Yes. Really, it's important to just really convey, because your body the best.
Yeah.
And it's really important just to really be very specific in regards to, well, I'm itching. It's not normal. I'm itching all over my body. If indeed that's the case, I'm itching at night. It's waking me up. I can't sleep. And then just to touch on a little bit of the other possible symptoms that may be present. Yeah. Again, not everyone, but this does happen. It's right upper quadrant pain. So it's pain on the right side where the liver and the gallbladder is. Sometimes that can be a symptom. And again, it's a red flag, or it's like, okay, this is not normal. Dark urine,
it's a very
that can happen. And so the dark urine can be something that may happen and be present as well. And I always say that support is so important in regards to family and friends, your spouse or partner, you have people there to support you, to advocate with you if indeed, you need backup to go with you to the doctor's office or to your doctor visits and all that.
And with ICP Care and the initiatives that you have, can you kind of talk to us about some of those initiatives for someone that has recently been diagnosed? What information do you provide to them? Just feel free to share anything about the org.
Yeah, so our organization provides evidence-based information and resources. We actually have a wonderful section on our website that has educational brochures. So it's for both patients and provider, and they're PDF links. You can actually send them to your doctors. You can print them out yourself, and you can actually also order free materials that we provide, both patient and healthcare professional brochures that you can order right from our website for free. They will get delivered to you. And then if indeed, you would like to send them to doctor's office locally or anything within your community, just to spread the word. We always encourage that.
It should be in every doctor's office.
It should.
Like, to me, that's just so common sense,
Yeah, exactly. So we've done such an amazing job, with all our volunteers and all our ambassadors to be able to just reach so many families and to really help the community. We provide a support group. So the support group is amazing because, a lot of times you feel alone. You're like, oh my gosh, I have this, and then you have other pregnant mommies that you're talking to. And unless they have intrahepatic cholestasis of pregnancy, they really can't relate to you, because this is something so very different and so very distressing, because, it adds a layer of unnecessary anxiety because of the risks, and again, the risks do vary depending on the bile acid level. If your bile acids are higher, then the risk is higher. The percentage does increase for stillbirth. But if you are being managed and taken care of, and you have a plan in action to really react and make a decision with your doctor for early delivery, which is one of the really important treatments, then again, you can rest more at ease. And, it's not about scaring anybody or putting fear into anybody, not at all. It's about education and knowledge, and really having an open communication with your healthcare provider, and really understanding intrahepatic cholestasis of pregnancy to really make educated decisions to ensure that your baby's going to arrive safely. But another thing that we do provide is we started our patient registry, which is really amazing. And it's going to really allow us to have to study both pregnancy and infant concerns, as well as to continue to monitor the implications of ICP and really on lifelong health. So in other words, after you're pregnant, okay, thankfully, you have your healthy baby, you're healthy, you're not itching, and but sometimes it does, what does occur, we've seen, and it's in the literature, that you may have underlying liver issues. And again, that's something that you should be aware of, because you indeed want to be able to take care of yourself after, and just get the proper, doctor's visits with the hepatologist or gastroenterologist to really check yourself to make sure you're okay. And
And so how can people be a part of this collection of information for the registry? I know we have the website on the bottom, but is it just a relatively easy, you're just able to fill it out, or how does that work for people?
Yes. So on our website, on icpcare.org, on the main page, you click, it says join our patient registry, and then it will take you to the page on our website, and I'll just give you some information, kind of like on frequently asked questions that you may have. And then you're going to click on there, and it's going to take you onto the platform to be able to register. It is completely free. And what you're going to be doing is it's patient driven, and it involves just filling out a series of questionnaires about your pregnancy and your experience, your medical history, and after your pregnancy, your family history. So this, again, is going to really provide just the valuable information to get more support with research to get answers for questions that we may not have. And again, this is really, I've always said this from the beginning when ICP Care was really born, is that we have strength in numbers. So as banding together, really joining together is where our strength lies. So this patient registry is just really a beautiful one-stop shop for us to get band together, to have strength in numbers, to have more knowledge, to have that information, to be able to provide. Yeah.
And you're doing the work for the researchers by gathering all the info.
Exactly.
And we need some researchers to come and really study this. Do you find that it is studied more in other countries, or are we still kind of in that space of trying to get the word out about ICP and all of that?
Yeah, there's research happening in different countries, but honestly, it's everything is money. So there's there's grants that are needed. There's just money to be able to back up research and to really have that as a benefit to our community. So just a patient registry is really allowing us to cover that ground, to be able to again connect with researchers and to have that information, like you said, that the bank, the database, and the bank of information to be able to work with researchers and all that.
Absolutely. I see we have a comment. What are the mental health issues that may come up when you're diagnosed with ICP?
Yeah, so as I was mentioning before, it's just an added layer of anxieties that knowing the risk of stillbirth is there. But so it can cause like mild depression in moms. You're already in a delicate state. You're pregnant. There's so many changes happening. You want to protect your baby. Your body is creating this miracle, and just to have that added layer of anxiety due to the risk. And again, that's not to bring fear into this, but it's a concern, and it's a valid concern. And
I can imagine, especially if you feel like the provider's not listening to you when you're sharing these concerns of symptoms.
Yeah, exactly. And that's another added thing, right? Concern and stress level. But, again, support, coming onto our community, allowing yourself to really honor how you're feeling and that you're definitely being heard. And I always say this because within the community and throughout the years, it's just part of any support or anywhere you are receiving a service, right? You can get a second opinion. You can get a consultation. You can change doctors if you're not being heard and you're not being honored in regards to what research information is out there and open communication. And it's just part of making decisions that's best for you and your baby.
Yeah, absolutely.
Yeah.
And so as I know June, the awareness month is coming to an end, are there any other initiatives that you have going on specifically for this month that people can join in on in these last few days of June, or anything major coming up, or just visit the website, follow Instagram?
All the above.
But things, of course, but anything specifically for June as the awareness month part?
Yeah, I appreciate that. Thank you. Yeah. We have a virtual ICP walk run. It's a 10-mile challenge that you can register. You can create a team. You could join a team. And it's really easy. It's on our website. We also have an amazing toolkit page that is available on our website. And it is also on our homepage that you can find. And there, really, it's just kind of like a one-stop shop, and it allows you to see how you can help us by just simply going onto our social media and sharing our banners, sharing our educational images, sharing. And again, sharing is just the best way. We see such an amazing reach and increase in how many people are viewing and seeing this. And again, it's amazing because honestly, you're saving a life. It's education, spreading the word. And on our toolkit page, we also have the registry link there. So it's really beautiful one area to have everything. And we have educational images that you can save onto your device and then just post it yourself. If you don't want to share our images, directly from our social media, you can just save what we have here on this page and then put it on yours. We also have an amazing YouTube channel that has stories and also patient and healthcare provider videos, and an infographic that is actually moves, and it's a little bit integrated with music. So there's just a lot of ways to just be able to help us this month. Although we're at the tail end of it, it's not the end, because we do continue this
every day
throughout the year.
It's every
Exactly.
day. I totally get that. And I really want to stress how you mentioned just sharing the info, because even if it's not a condition that someone may personally have, we are all in this together. Our push community is very strong, and we're all here for a reason. And so it's important that we are paying it forward and sharing all of the information that we can, because it might benefit a friend. So,
Definitely.
Donna, thank you so much for joining us today. I'm so happy that we've made this a yearly tradition.
Yes.
And as I said in the beginning, I'm like a little rusty. So I forgot, you guys, I didn't even introduce myself when we logged in. I'm Liz, the Director of Education for Push. Sorry about that. But thank you, everyone, for joining us. I'm so happy to have had Donna here. And please give ICP Care a follow. Check out the website. And most importantly, remember to share it with someone, because it could help someone else in their journey. So
Yes.
thank
Yes,
you.
thank you so much. And thank you for all you do in Push Pregnancy, for all the parents and the great work working to end preventable stillbirth in the U.S. and educating and with advocacy and just community.
Yes, we can do it. And so if you're new to our page and our live and our Instagram and all the things, make sure you check out pushpregnancy.org as well. We have incredible information, as well as our trainings that are now accredited that you can send to your providers. So we have a lot going on both with Push and ICP Care. And if anyone has any questions that you maybe, I know I always do this, I think of questions later on, please feel free to comment when the post is on our feed, and we will try to get you answers as soon as possible. All right. Have a good one, everybody.
Thank you.